Nipple discharge explained. Welcome to my YouTube channel. This is Alema Health Matters. Is this your first time? I urge you to subscribe to my YouTube channel, like this video and also share. You can also comment on the comment section and share your views about this video. Don't forget to click on the bell so that you will be notified every time I upload a new video. This episode objectives are nipple discharge symptoms, common causes of nipple discharge and breast cancer, and when to seek help with nipple discharge. Nipple discharge is any fluid or other liquid that comes out of the nipple. You might have to squeeze the nipple to get the fluid to come out, or it could seep out on its own. Nipple discharge is common during reproductive years, even if you are not pregnant or breastfeeding. Nipple discharge is usually not serious, but still it can be a sign of breast cancer. Nipple discharge is typical during pregnancy and breastfeeding. More than 80% of people with female hormones have nipple discharge at some point. It can happen at any time to anyone, even those with male hormones. Nipples can excrete fluid for many reasons. You may be concerned about cancer or precancerous conditions, but rest assured, nipple discharge isn't typically cause for alarm. There are normally 15 to 20 milk ducts opening onto each nipple. Discharge can come from one or a number of these ducts. Nipple discharge symptoms. Nipple discharge changes depending on the stage of life, such as premenopausal, postmenopausal, pregnancy, and breastfeeding. Discharge may occur suddenly and on its own, or on when you squeeze the breast or nipple, which may be thin and clear, slightly thicker and milky, purulent, that is pus-like and cloudy, very thick, sticky and cheese-like, presenting with many colors: clear, milky white, yellow, greenish, brown and reddish. Nipple discharge may occur on one side, that is unilateral, or on both sides, known as bilateral. It may come from a single breast duct or multiple ducts. If you have symptoms along with discharge, they can be clues to the cause. For instance, a fever may suggest a breast infection, that is mastitis. Missed periods may be a sign of pregnancy. A breast mass discharge is highly suggestive of a breast cancer. Common causes of nipple discharge. Number 1 is pregnancy. Colostrum, which is the pre-breast milk fluid, may leak before delivery. It's usually thin and light yellow. It then turns thicker and milky. Breast irritation. Irritation from rough clothing or a poor fitting bra or excess stimulation or trauma to the breast may cause discharge. Fibrocystic breast If you are premenopausal and have fibrocystic breast, that is lumpy, possibly painful breast tissue, yellow, green or brown discharge before period is somewhat normal. Hormonal variation. Normal hormonal changes, for example menstruation, may cause nipple discharge. Also, prolactin level changes due to a medical condition. That's true no matter your biological sex. Hormonal medications. Hormonal drugs like birth control pills and sedatives often cause a milky discharge. Nipple discharge and breast cancer. Breast cancer can cause nipple discharge, especially ductal carcinoma in situ, an early form of breast cancer that starts in the milk ducts. It can also happen with Paget disease of the breast, a rare type of breast cancer that involves the nipple. If you do have breast cancer, the discharge will probably only come from one breast. You may have a lump in your breast too. Discharge is rarely due to cancer. However, it's still a good idea to get any breast discharge checked out, especially if it's a new symptom for you. When to seek help with nipple discharge. It's especially important to see a healthcare provider if you have a lump in your breast, you have nipple or skin changes such as crusting or color change, you have pain in your breast or other symptoms of breast cancer, the discharge is bloody, only one breast is affected, the discharge doesn't stop. In men, it's important to see a healthcare provider if you notice any nipple discharge as it's uncommon. Then the healthcare provider will do a clinical exam to check your breast for lumps or other signs of cancer. You may also have one or more of these tests like biopsy, mammogram, ductogram, ultrasound, and a fine needle aspiration being done to you. This is the last part of this discussion. I urge you to subscribe to my YouTube channel, like this video and also share. You can also comment on the comment section and share your views about this video. Thank you so much for watching.